Since introducing the first edition of the NSQHS Standards in 2011, the Australian Commission on Safety and Quality in Healthcare has reported numerous improvements, which have contributed to better patient and public health outcomes. Building on these important gains, the Commission released the second edition NSQHS Standards in November 2017, with assessments against the revised standards commencing 1st of January 2019. The Commission also reviewed the accreditation scheme and has made some important changes to the way in which assessment is carried out. We're very pleased that following a comprehensive application process, the Commission has granted QIP approval to assess against the second edition standards for the maximum awardable period of 3 years. As one of only a few accrediting agencies approved to assess against the standards, we have been readying ourselves to hit the ground running to ensure the best possible outcomes for our clients as we together transition to the second edition standards and revamped assessment process. Let's start with what's the same. Firstly, the Commission is very clear that the intended purpose of the second edition remains unchanged from the first. That is, to protect the public from harm and improve the quality of health service provision across Australia. And in good news, the Commission also advises that the second edition standards are easier to understand and implement. The trade-off is, though, that the bar for assessments has been raised, as it should in any continuous quality improvement journey. The second edition addresses important gaps identified in the first, and is clearer than its predecessor, with duplication reduced through consolidation of relevant standards and actions. It comprises a streamlined 8 standards and 148 actions, compared to the first edition's 10 standards and 256 actions. Further, all assessments will move to 3-year cycles, with no requirement for mid-cycle reviews or a 4-year assessment cycle option. The revised standards have an increased clinical focus. This, combined with the changed assessment process, means that assessors will use a more structured and rigorous process to facilitate a more consistent evaluation of actions across all health services. And this is just for starters. There is a lot of new information associated with the revised standards and assessment process. QIP urges you to go to the Commission's Welcome to the NSQHS Standards website as your first point of reference. Read the standards and the fact sheets to identify what applies to you. Download the resources that are relevant to your type of health facility and your role within it. QIP has developed a handy booklet for our clients. It's a snapshot summary of what we think the most significant changes are between the first and second editions and the assessment process. It's now available in your accreditation hub, or ask your client liaison officer to send you a hard copy. No matter what type of health service you are or where you're located in Australia, as you plan for your next accreditation cycle, QIP welcomes your inquiry and queries. With our ongoing commitment to safety and quality, we'd love to work with you to uphold and improve what is already one of the safest health systems in the world.